Matt Calzia, and I work for the Oregon Nurses Association. I'm a nurse practice consultant. I've been a nurse for 10 years. I've done mostly critical care, ICU, cath lab, rapid response. And I took a job about 2 years ago with the Oregon Nurses Association where I help other nurses throughout the state around practice-related issues. And I still do maintain a bedside practice down in the Eugene-Springfield area. So real quick, I'll just go over some of the RN employment trends. Demand is and will remain high. The Bureau of Labor Statistics projects 12% growth, which is way above the average. And I suspect in the next year or so, we're going to hear that it's actually going to be much faster because there's been a pandemic that has changed the landscape a little bit. So there's more than 371,000 new jobs coming in the next few years. I was talking to a chief nursing officer at a hospital in Oregon, and she pointed out just to manage turnover in a hospital where they have about 1,000 nurses, they need about 130 nurses a year just to replace the ones that leave. And a lot of that's retirement and whatnot. So the job opportunities are always, they're going to be there for a very long time. It's going to be a very secure profession. Compensation-wise, in Oregon, the average nurse with a bachelor's degree is making around $92,000. The national average is around 80. And again, we're seeing that going up a little bit faster in the last year and a half. And then for advanced practice registered nurses, which are your nurse practitioners, nurse anesthetists, psychiatric nurse practitioners, they're coming in around nationally 110,000 a year. And that's another field that in the future is going to just continue expanding. And then as far as demographics of who makes up the nursing profession, it's about 80% females, 9% are male. That's gone up about 2%. They're not collecting data on non-binary yet, but hopefully that'll start to change as they progress with collecting the data. About nearly 10% Black, 8.3% Hispanic or Latino, 1.3% of nurses identify as 2 or more races. I think the American Nurses Association and the nursing educators in the schools are really working on trying to figure out how we can really make the nursing workforce more diverse. And that is something that has a lot of focus right now and a lot of movement. And I think in the future, we're really going to see that so that there's better and broader representation in healthcare across all of the professions. The slide I noticed now looking at it is a little bit jumbled, so we'll talk through it. So as far as what you can do in nursing, this is where it becomes like we could probably talk for an hour just on all the different specialties. But the first thing folks often think of is that acute care in a hospital kind of nursing. And that's where we see probably a little bit of the higher pay. And that is the most typical work environment that folks think of. And there you could work on a medical floor or a floor that just specializes in treating cancer patients. So oncology, or maybe you're in a post-surgical unit where you're taking care of patients who just had different kinds of surgery. And those become specialized down to, is it cardiac surgery for open hearts and things like that? Or is it orthopedic where people are having their knees done and their hips are being replaced? And then there's all the critical care arenas like the ICUs. And then you get into procedural things like cath lab, where that's where they do kind of non-invasive procedures, but the nurses there are engaged in assisting the physician during the procedure, or maybe the nurse is the one who's in charge of sedating the patient. PACU is where nurses recover patients from anesthesia. So a physician or an advanced practice nurse provides anesthesia to the patient during a procedure or a surgery, and then a nurse recovers them and gets them through that phase of getting out of those medications, which are pretty severe medications when you think about what has happened to you when you go under. And then we also have in the hospitals, it gets down to very specialized nurses who just do things like put in IVs and manage the specialized IVs that nurses or that patients get, and on and on. There's RN care managers who help patients as they're going to transition out of the hospital, or maybe a patient comes into the hospital and they don't have health insurance set up, and an RN will help and coordinate specialists when they discharge. So that's in the hospital. More and more in the future, we're just going to continue to see nurses becoming a larger workforce in the hospitals, and then also directing the care of what goes on in the hospitals. It's becoming, historically it was very physician centric, and now we're seeing patient outcomes improve when it becomes nursing centric. And we focus on what are the nursing interventions that help patients get better. And then when we get out of the acute care arena and we're out of the hospital, that's where a very rapidly growing area for nursing is home health, home infusion, and home hospice or palliative care. Those are, costs. The last estimates I saw where it costs around, $1 million to build out a hospital bed, like a critical care bed. So you could say somewhere between a $500,000 and $1 million just to put a bed in a hospital. And OHSU is going to expand, and I think, I'm sorry, $500,000. They're looking at $500 million to add 150 beds to OHSU. So it's incredibly expensive to do hospital care. And what we know with technology and the advances that we're having in technology is that home health is going to be continue to be a rapidly growing space for nursing. And that's where a nurse goes to a patient's home and provides care. So it may be like someone who went into the hospital, they had a procedure, they left the hospital, they went home, but they still have a wound from the procedure. And so a home health nurse can go and help manage that wound, check on the patient, make sure they're progressing along their clinical pathway. And then they also have home health nurses who will go in and help with the management of chronic illnesses like heart failure and diabetes, and make sure that patients are staying out of the hospital and that they're getting the support they need, and maybe they need that to occur in their home. And it's a much more, it benefits the patient because they're in their comfortable space. It benefits the healthcare system because we're not using hospital beds and hospital care. Or a nurse may just show up to provide infusions, so they can give an IV medication like chemotherapy, or perhaps the patient needs blood products on a regular basis, and a nurse can go to the patient's home and administer those medications or blood products. And then with hospice, it's nurses, and this is, RNs play a huge role in this, in providing that end of life supportive care to patients and their families as they transition and die. And that is another space where we're seeing there just aren't enough nurses to provide. And the New York Times recently had a piece on it, that this is a space with our aging population, a large baby boomer population, where we know we're going to need a lot of compassionate, educated nurses to be able to help people transition to that part of their life and help their families navigate end of life care. In these environments, nurses have a really high level of autonomy, and that's going to continue. I suspect that nurses will get even more and more autonomy. We already see, and I think we'll see an expansion of home health and hospice agencies that are totally nurse run, from an advanced practice registered nurse, and then RNs who do the visits, and nursing assistants who provide some of the care in the home. So this is an area where nursing already has a very large footprint, but will likely continue to expand and continue to have more autonomy. And then, we can keep going on. School nurses are vitally important. Hopefully we'll start to see more resurgence of school nurses, because, it used to be that every school had a nurse, and they were able to help manage students' health issues and whatnot in acute situations that rise, and also look at the school nurse as that authority on infection control in the school. Now that we've seen what a global pandemic looks like, we see that space, that void, wasn't good. And so we need to bring back nursing back, get nursing back into the schools, because they provide a valuable service to the students and the staff. Occupational health agencies will employ nurses to work with, making sure that to help prevent injury in the workplace, but to also look at what happens to employees that get hurt in the workplace and how to help manage that. Insurance companies hire nurses to look over insurance claims. Legal firms hire nurses to evaluate like medical malpractice issues. A very big growing part of nursing is nursing informatics, and that's because we now have big data, and there's a little bit more on that later. But nurses who are just getting into the research phase, education, research, informatics, like delving into all that data, and then synthesizing it in a way that will help the nursing profession and subsequently the communities that nurses serve. the big industry changes that are coming are like everything, technology is a huge factor, but also our scientific advancements. In the 10 years that I've been a nurse, the science and the technology stuff that I've seen has been profound. One thing I can think of is like a heart valve replacement. When I started as a nurse, the only way you could have like your aortic valve replaced was where they had to actually do open heart surgery. And in that 10 years that I've been a nurse, I've seen them create a new way where they can just access a large vessel in your leg and use a tool to bring a valve up to your heart through a vessel in your leg. And then they can open the valve up once it gets into your heart and replace your valve that way. And so patients, and it's not for every patient, but the patients who undergo that procedure, they no longer have to have their chest cut open and have a surgeon go in and manipulate the heart, cut through the heart and put the valve in. And so that came, and then the advancement of that procedure has just been incredibly rapid, where it's going to, it's going to just keep taking a larger and larger part of heart surgery. And it's amazing. It's better for the patients, but with that comes a lot of new nursing assessments that we had to learn. And so that's where, as science is moving so rapidly, technology is changing so rapidly. In nursing, you're going to, if you choose that path, you have to be always willing to continue your education and stay on top of those trends. As far as the changes in the Oregon healthcare system, a really big shift is just the reliance on advanced practice registered nurses. We have, in Oregon, we have a lot of critical access areas, rural areas, where it's difficult to get physicians. There's fewer and fewer physicians who do general practice. They tend to go now more into specialties for a variety of reasons. And so advanced practice registered nurses can kind of help and fill in that void left by physicians who specialize. And advanced practice nurses can provide a lot of primary care, urgent care, and comprehensive care for patients. The data shows that when an advanced practice registered nurse manages a lot of chronic illnesses like diabetes or COPD or heart failure, patients actually can do better because of that nursing process. Nurses are very holistic, they're very trusted, and they have a good communication process with patients. And so they can have some really good outcomes when managing chronic illness. So I think in the state of Oregon, we will only see that expand, that reliance on APRNs. We still have work to do to incentivize more of them spending, doing service in more rural regions. And then as healthcare, as we move to an emphasis on out of hospital care and prevention, that's where, again, nursing, advanced practice nurses and RNs will be more in demand, and we'll just continue to get more autonomy. We're great educators, and we like I said, we have that holistic approach, and so we're well suited to manage like healthcare, not sick care. And so ideally, that's where we're gonna start moving. And then with the electronic medical record, that's where that informatics comes in. We now have really big data, and we switched from, before we used to keep all the records on paper. Now it goes into big computers and data centers, and they can culminate all of this really large data to understand like what makes the impact on the nurses in all arenas: home health, inside the hospital, long-term care. And what we know is that nursing care is a huge factor in how patients do. This is just a good quote from Florence Nightingale on nursing, and it's and what nursing has to do is to put the patient in the best condition for nature to act upon him. And I think that kind of, somebody once put it to me, to kind of delineate professions, and we all work together. I don't want to say like there's physicians and there's nurses. It's a very collaborative process, but the physician treats a disease that happens to be inside a human, and the nurse treats the human that happens to have a disease. And I think that's where there's a little bit of a philosophical delineation of nursing and medical practice, physician practice. And again, though, it's a synergy, the way that nurses and doctors work together. I would also say, I had no plans of doing what I do now, it's been just this path of, because of that continuing education and how many different opportunities there are in nursing, it's led me to places that I didn't know, that I didn't know where I would end up. And it's been really exciting. There's always something to do and learn and something new to achieve through nursing.
Could you talk just a little bit about how did you or when did you decide to become a nurse? Because you mentioned that you first went to community college for that. So when did you start to set your sights on nursing?
I was a career changer. I was actually a chef before I was a nurse. I started out as like a dishwasher, worked my way into being a chef. And then when I got older and had a family, and I wanted something a little bit more challenging and rewarding, and then I made a switch and went to community college. So I went to Lane Community College in Eugene, and I already knew I wanted to go into nursing, but I had to do my prerequisites and go through that whole process. And then after, and what made me, well, that was, so when I decided, I think I was like 32 years old or something. It was definitely later on. And then after I started working in the ICU, I went back to school to get my bachelor's degree. It took me about 2 years because just starting in the ICU is so much to learn that I went through a new graduate residency program. And then, about a year and a half after I got out of that program, it was still just, it's so much information and it's so much, stress, but good stress, that it took me a while to go back and then get my bachelor's, just because there's a lot of learning in the unit.
So it sounds
And
like you learned more about your specific role in nursing through your position, through your job versus through your education, like through your classes.
I think, especially at the associate's degree level, it's a very broad nursing education, and you're going to learn a lot when you start your practice. And I think most medical centers are doing like new graduate training programs or residencies. And I think hopefully what we start to see, I've talked to a lot of home health and hospice nurses who expressed like it would be a good place for nurses to start their career there too, but we haven't made that cultural connection. And so it tends to be nurses are kind of funneled into the acute care arena, and then they might later move out to like a home health or hospice. And seeing how the nursing is changing and our healthcare systems are changing, I suspect that we'll start to see more new grads going into places like home health, hospice, and specialties like that. But you do get a lot more of that on the job kind of education. And then when you get into the bachelor's prepared nursing, you start to even look at it, more like community views on healthcare in a more expansive view.
Great. Thank you so much, Matt.